listening to episode 268 of Mitolife Radio. I'm your host, Matt Blackburn, and today I'm interviewing Dr. Leedia Riman. Leedia is an integrative dentist based out of Southern California, and she really does have an integrative thought process, really analyzing someone's life when she works with them, seeing what their nutrition was, if they're mouth breathers when they sleep, just looking at multiple factors so that she can paint a picture of what's going on in the person. I was really inspired after speaking with Dr. Leedia in this show to really step up my game with my oral care. It's definitely an area of human health that's often underappreciated, overlooked. So hopefully this interview inspires you like it did me. So overview of what we talked about in the show. I asked her thoughts on vitamin D and vitamin D testing. She shares what multiple cavities mean for your overall health, why she's not a fan of shaving your teeth down, what it means if you have a brown or grayed out tooth. I ask her about acid exposure, coffee, wine, cigars, citrus juices, carbonated beverages, and their impact on the teeth and how to mitigate it. She talks quite a bit about mouth breathing and the nitric oxide connection. I ask her thoughts on mouth taping, running a humidifier in the bedroom, her thoughts on waterpiks and whether they replace flossing. She talks about why she loves ozone, sodium fluoride versus hydroxyapatite, her thoughts on electric toothbrushes. And then we get to a few of the listener questions. We ran out of time. That was like a new record for questions that people sent in on social media. But I got to a few. What are the best tips for receding gums or gum health overall? And the other question was, are root canals really as bad as some people say? So enjoy the show. Here is Dr. Leedia Riman. All right. We're here with Dr. Leedia Riman. Welcome to the show.
Thank you for having me.
Yeah, this has been a long time coming. I think we've been talking about this for like a year, and I've only had a couple shows, I think, on natural dentistry, and it's a hot topic. I mean, the healthiest people I know are dealing with teeth issues, and there's so much information out there. I know back in my raw vegan days, the thing was just oil pulling. And so I was oil pulling every morning before breakfast. And then I learned, oh, coconut oil is not the best. Like you want to use refined sesame or sunflower oil. And there's all these, you can just go so deep with it. And eventually I just got back to the regular, waterpik and brushing my teeth. But I'm excited to hear your perspective on it. And you were just saying before the show, the last thing you look at is teeth, right? In the overall picture.
Yeah. When patients come for a comprehensive exam, the last thing I take a look at is their teeth, because to me, that's the least important when I first meet you. Your lifestyle, your nutrition, your habits, your breathing, where you live, how you're living is very, very important to your oral health. And I think you said something that's super key is like the healthiest people are dealing with dental issues, people who are just, and I see that every single day in my office. And we call the oral area, there's a lot of silent disease that can happen in your mouth. And by the time it manifests and shows up, it's very advanced. And that's why, especially with dentistry, it's so important to have a strong, aggressive, preventive approach. It's truly worth an ounce of cure, because once it gets bad quickly. It gets the pain increases quickly. It gets really expensive quickly. It gets very time consuming and energetically draining very quickly. And the last thing I take a look at their teeth, because once I take a look at your teeth, the reason I love mouths and teeth, I love teeth, Matt, I love them because it tells a story. It tells me so much about a patient's story. No two stories are alike. So, but yeah, the last thing I take a look is teeth.
Hmm. Yeah, when I posted on social media, listeners to send in questions, I posted the can't remember what it's called. Is it the acupuncture chart of the like basically the
Meridian,
teeth, the
meridian.
meridians?
Uh-huh.
Yeah,
Yeah, yeah,
all
yeah,
the
yeah.
organ systems and glands that connect to the teeth. Yeah.
Yeah. So when I first got into this, I was like saying I want to put back the mouth into the body. So I went to UCLA School of Dentistry. Excuse me if I'm breathing hard. It's like so hard to breathe with a 9-month fetus in your stomach. Um, we the dental students, so there were cadavers, and we would dissect cadavers, and the dental students would go in, they'd do their thing, and then we'd leave, and then the medical students would come in and do their thing. And we should have done our thing together because the mouth is so connected to the body, and more research. So we can talk about the meridian chart, which is more traditional Chinese medicine, but there's going to be science guys that are going to be like, oh, I don't believe in that. But there is scientific research about oral connection to Alzheimer's, to dementia, to heart disease, to infertility, to premature labor and lower birth weights. Like there are so many connections. And then so it got me thinking like, damn, like I work very close to Cedars. We get a lot of patients to get cleared for organ transplants all the time. Like, why are they clearing for organ transplants? Like, once you're so advanced in the disease that you need a whole new lung or a whole new heart, and I'm not saying it's because of your dental issues, but that's additive to, you don't want an infection. If science didn't know that the mouth is super connected to the body, why are they sending us patients to get cleared from dental infection before a transplant occurs? Like to me, it's like, okay, like biological dentistry is the only way to go, you guys. It's yeah, it's so connected to everything.
That's interesting. So you said they send patients to get dentistry work done before an organ transplant? Is that?
Yeah, like
I've
before,
never heard of that. Wow.
yeah, before liver transplants, before
Wow.
like hip and shoulder, like before
Wow.
any transplant, because your mouth is an infection source for your body, and it's an hidden infection source. So you may ask, what are these sources in your mouth? So something as simple as if you floss and you bleed, you have a localized infection. Okay. You let that bleeding go for a little longer, that infection travels to your bone, the bone that's holding your tooth together. If it goes to your bone that's holding your tooth together, it's going to the rest of your body. So when you're flossing and you're bleeding, everyone talks about gut, leaky gut, leaky gut. If you're bleeding, you have leaky gums. If you have leaky gums, you have leaky gut. Like it's part of your digestive system. Yeah, I can go on and on. I don't want to ramble.
That's great. Well, were you dealing with dental issues? I know on your website you talk about there's like a pregnancy connection to how you discovered
Yeah.
some stuff?
So I woke up to all of this. So when you start going through life, like in your professional life, and like little things come your way, and you're like, there's something here, but I don't know why. And there's something here, I don't know why. So I grew up in Saudi Arabia for half of my life. And then so after I finished my schooling in the States, born in LA, but went right back there. And so I was the youngest dentist ever hired at Saudi Aramco, which is the biggest oil company in the world. And I get there and they needed me for two demographics, the expats, because they want US trained dentists, the expats, and then the women, because I speak Arabic and I'm a female. They feel more comfortable with a female. And I noticed all their mouths. Like I can almost say, I think 95% of the women that I saw out there had very broken down oral cavities, like root canals upon root canals, infections, bleed, like it's decay. It was horrendous. And I'm like, gosh, like, why? Like, why didn't they teach me about this in school? Like, I feel there's more to this. But at the time, I was single, I wasn't married yet, I hadn't had a kid. Long story short, I moved back to the States and opened a practice with my brothers, get married, and then I get pregnant. and I get very sick. I developed something called hyperemesis gravidarum, and I was throwing up between 7 to 14 times every single day for 7 to 7.5 months. So that like severe nausea, I have that. It's just apparently there's a genetic predisposition that they just figured it out. Also, then I learned a little more about vitamins and I'm low on B's, etc. Anyways, it's not about me. Anyway, so I developed an infection around my front tooth while I was pregnant. Okay. And I lost the crown of this front tooth. Like, so I was walking around with no front tooth. It looked very sexy. And I didn't want to put the crown back in because I don't want an infection source to travel to my baby. That I already knew. And it was a very hard period of my life, mentally, physically. I couldn't keep anything in. The acidity impacted my teeth, like bless. So I don't know if you know, both my brothers are dentists. So they were helping, my older brother, he's the one I work with now. He was literally doing cleanings on me every single month to keep my oral pH at bay. Because
Wow.
had I not done that, I would have developed so many cavities. And then that's when I'm like, God, like these women I was seeing in Saudi Arabia, they have had like 7, 8, 9, 10 kids. Like, they reproduce a lot more out there. And then I started learning about the importance of vitamin D3 and K2. And it's not just, oh, eat your calcium, drink your milk. And, of course, calcium's important, but you need to upload the calcium to the right place. And vitamin
Mhm.
A and raw food and how important, raw milk and raw your diet, the Weston Price. So I started
Mhm.
like opening my eyes to all that. And it was when I was about 3 months postpartum, I was like in a really hard place in my life because it was the first time I've ever gotten sick in my life. Like sick, sick. I have a baby depending on me. I'm trying to breastfeed and I'm having a really hard time with breastfeeding. And at the time, I didn't know about tongue tie or oral ties. So it was like you can imagine a perfect storm, and I'm in a really bad place. So I was either going to go down a really hard route or like I had to not snap out of it. You don't snap out of it, but I needed to make some solid changes in my life and how I lived my life and how I practiced. And I did. I discovered biological dentistry. I became certified with the IABDM. I actually have one more thing to submit, but I finished all the coursework and I'm like, oh my God, this makes so much sense. So I started learning more about like fluoride and vitamin D deficiencies and animal-based vitamin A and mouth breathing and methylated um, supplements to prevent oral ties. So that was my story. And then I completely like shifted the whole practice. Like we lost so many patients because it was so like weird for them. Like, oh my God, what's happening? But then God opens doors, like it's flooding now. So it's amazing.
That's
Yeah.
an awesome journey. Wow. Were
Thank
you like me where you grew up not eating a lot of high quality animal foods? Like you mentioned Weston Price.
I think the reason my teeth are still okay after three hard pregnancies, especially my first pregnancy and this pregnancy have been the hardest, is because I was eating liver all the time as a child. So I grew up
Oh,
in Saudi, but we're ethnically Lebanese, and in Lebanon, like you have liver 2, 3 times a week. The quality of the meat where I grew up was excellent. It was really, really good. I remember when I first moved to America, I was like, the meat here tastes so weird. Like we'd go to Albertsons and get our meat because of course, like it's you just go to the store down the street. Like I didn't know more, I didn't know like how the milk was and the difference between raw and pat. Like, we didn't have that back there because when we'd spend our summers in Lebanon, I come from a village. So you just get your stuff like from the village, like you get good quality stuff. So I wasn't conscientious of that difference until I moved to America. But I think my teeth survived the hyperemesis gravidarum because of that. And then I connected the dots. Like in Saudi, they're covered. The women are covered. They have burqas. They're wearing the black coverings all the time. They're not getting vitamin D, even though it's one of the sunniest countries in the world. Vitamin D supplementation opportunities in Saudi is like the highest in the world. They also take a lot of antibiotics, like not just in Saudi, it's like a Middle East, it's even here in the States. I've had patients get mad at me when I didn't give them antibiotics. I'm like, you don't need antibiotics. Like, so your gut health is very important to your oral health. Also, kids are not eating hard foods. I remember I used to eat like crunchy apples from the trees in our villages, and like I utilized my mouth to chew. Nowadays, like kids are cereal, purees for the little kids when they're babies. So it's a completely different like lifestyle
Mm-hmm.
and life approach. So it made sense to me at that time when I had the baby.
Wow. Yeah, I'm jealous of the liver growing up with that. That's awesome because I was raised on just standard American and, you
Yeah.
know, regular milk and cereal and snacks and
Yeah,
pizza
yeah.
and
They don't know any better. That's why these podcasts are very important and that's why I love to focus on women's dental health and women because they're the ones who are doing a lot of the grocery shopping for their families and feeding their families and making changes, And I always say, do what you can when you like Angie says it, do what you can in the season you're in. And I love that because it's not always going to be perfect. Like, look at you, but now you know. So now you know what you're doing. Now you know better. Like, my husband was a raw vegan for 4 years before I met him. And when we met or like reconnected, because I've known him for a very long time, his wrists were like giving out on him. Like, it was like crazy how he's a 6'2" guy, multiple Ironmans, like very athletic, very fit. And I was stronger. Like he would not have been able to extract a tooth like I extract teeth. So I saw him make a shift, and I'm not going to get into food wars with anybody here. Like if people go crazy about food, I'm just talking about the facts that I'm seeing. I have a lot of vegans in my office that I support the best I can with what I can. But I saw him make the shift, and within like 3 months, he regained his strength.
wow.
Yeah. How long did
Yeah.
it take you?
It was, well, I went pretty hard on the ground beef and bison after I got out of it. And so I think it only took me like 6 months to a year to recover. And I told the story in my podcast, the ab roller. I did my first standing one, and I was next to my bodybuilding friends that have been bodybuilding for 10 years, and they could not do one. And just rebuilding on meat, I was able to do it nose to ground and stand back up. So I was pretty proud.
Awesome.
But I
Yeah.
think I think vegetarian is possible for some people, but I question vegan. I mean, you really need to probably supplement, and it's going to be pricey to do it that way. So,
Yeah. To get the proper supplements, to get supplements that you actually that work synergistically together and are
mhm,
uploaded to the right area of your body, that's hard. Like it's very hard to
mhm,
do. But yeah, vegetarianism, you can do it a little more. But I'm just seeing it impacts your teeth as a
mhm,
vegan more than I really think that's what protected my teeth because I grew up eating really good meat and we also have this dish in Lebanon like only like my grandmother I don't think I'll ever make it but it's like literally every organ of the cow we use and cook and we stuff with like beans and rice and we make massive broth from it and that's all nutrients and health but yeah I'm not going to be doing that whole tongues and intestines and
maybe,
yeah
maybe desiccated, right? Yeah.
yes, yeah exactly yeah
It's interesting about the Saudi Arabians. I never thought about that with the what's it called, the burqa, right, where they're
yeah
covered from the sun.
yeah
Do you often recommend clients get vitamin D, like a 25D test, if they haven't done it to see where they're at? Or
Yes, yes.
Mm,
It's so important, especially if you're going to have dental surgery.
mm,
Because when you're healing, it really is dependent on that, like the healing. Especially if you're premenopausal or menopausal, I recommend that because during that time, the osteoblasts, osteoclasts are changing with the changing levels of estrogen and progesterone in your body. So for sure, like if you have multiple cavities in your teeth, it's a reflection of your bones. Like it's not,
Mhm.
that's what I mean. Like it's so important to connect from the dots from your mouth to the rest of your body, especially as a woman, men, of course, but women especially because of all those hormonal fluctuations. And women don't pay as much attention. Now, like times are changing. Like there's so many amazing people talking about muscle, building muscle, how important muscle is for a woman, for aging in a woman's life because of all the hormonal fluctuations, etc. But vitamin D
Mhm.
tests are crucial. We do them before major surgeries, where if we're going to place implants, extract, we do integrative dental extractions in the clinic. And then there's some people, they have so many unexplained cavities to them. Like, I mean, you can tell by an x-ray if someone's vitamin D deficient after a while. But every person, they did a study on children, 95% of children with cavities are vitamin D deficient. Vitamin D is so important. It's vitamin D and animal-based vitamin A. Those are two, and K2, vitamin K2, because those three need to work as a tripod to get the calcium, bring it into the cell to the right area of the cell. You need those three. So I grew up saying, like, my dad's like, oh, drink your milk. You need your calcium. You need your calcium. But it's not just, no, people, you don't need as much calcium as you need the other things as well to
Yeah.
uptake.
And magnesium and boron, right? There's like so many
Yes.
nutrients that, I mean,
Oh,
and there's probably so many deficiencies that people go their whole life without knowing, you know?
100%. Magnesium and boron are huge, especially magnesium, but magnesium, boron, selenium, zinc, it's all part of all these nutrients help you make up your bone, and whether it's enamel in your teeth or your actual bones.
Yeah. Yeah. I remember in school, I was like getting the calcium hammered in, which is a essential nutrient. It has so many positive effects. It's an anti-stress and it's kind of similar to magnesium, but we can't just focus on one. I think, forget the book I read years ago. I was talking about all the minerals in bone, and it's like somewhere between 12 and 15 or something like that. Different,
Yeah,
at
I
least.
think I have, no, I have the magnesium factor here. It's a whole book just on magnesium and how important that is. But yeah, there's and it's very similar between bone and teeth, these minerals. But the reason I like kind of simplify it to like the vitamin D3, K2, and vitamin A is because I want to give people a starting point. And once they get better with that, then we do micronutrient testing sometimes in our office, and we like take a look at everything, like your entire panel. Um, there's nothing more stressful for me, I'm going to talk personally, than if you're having to take like so many supplements at one time. Like it's discouraging, especially if you have children. Like I'm pregnant. The last thing I need is like, it's just too much. So I try to make it realistic for patients and people. But yeah, magnesium is huge. It's very, very important as well.
Yeah. Yeah. People could definitely get overwhelmed easily. Um, yeah, one of my first experiences with teeth in the middle of my raw vegan experiment, I had a Myron glass bottle, and I just gently tipped it back to my mouth to take a swig, and I chipped my front tooth. It was just so brittle, and I just let it go for years. And I thought it was just going to heal up, because I was of the raw vegan mentality. I'm Superman, right? I can regenerate like Wolverine, and I think like eventually with all the acids and stuff that I feel like I got an infection, I think in my front tooth that went up. Um, so it sounds kind of similar to what you experienced, right? Was it? I don't.
Totally, totally. For me, it was more gums, more of a gum infection because this tooth is actually an implant. I was born missing that tooth. I
Oh, mm,
braces multiple times, but you have no idea how many times, Matt, I hear that story with a glass, especially glass bottles, beer bottles, and then nursing babies, like kick their mother's butts while they're nursing. They're like, psh, psh. So, and if your teeth are brittle, it like the crack is going to propagate. So I always, just to that, I just want to say, never let any dentist shave your teeth down, please. Always add. always have the dentist add. Like if you have a crack in your tooth, like a small crack, we call that cosmetic contouring in our office, but it's just a filling, but it has to look nice, obviously, not just a filling. Um, but never let a dentist shave your teeth down. That's like one of my pet peeves because God created us with a limited amount of enamel and there's no need for us to shave it. I'd rather you break down my composite than for you to just shave down, for me to easily just shave down your enamel. So
Mm.
just have to say that.
It's a good point. Yeah, because I consider that several times. I'm like, oh, can they just take like an angle grinder to it and just like whatever,
We
just
can,
shape.
but no, we can. That's the easier way. That's the easiest way. Just I just it traumatizes your nerve. It removes unnecessary tooth structure and why? It's not a piece of hair. It's
Yeah.
not a bad haircut.
I was gonna save this question for the end, but I'll ask it now because it's a good time. So you said God created us with a limited amount of enamel. Uh, I just saw, I think a couple days ago, they put the first Neuralink in a quadriplegic guy, and he was controlling a laptop from it with his mind. And we're entering some interesting times.
Yes.
Like my most exciting technological advancement is going to be with dentistry, if it's possible to like regrow teeth with
Yeah,
who knows peptides or something crazy that do you think at some point we're going to be able to like
I think
increase
so.
the enamel
I think so. I mean, even now there are so I created a course for families to remineralize teeth to make your enamel stronger, to reverse dental cavities and halt the progression of larger ones. We are at a point where we can reverse the cavity in the enamel layer in the sense that we can make our enamel stronger, what you got there. But the regrowth of new enamel, I haven't seen yet, but I am very hopeful that it will happen. I don't know when. I know they're starting in some places. They're starting like in vitro studies. They in the lab they're able to do it. So I feel like it's just a matter of time, um, which is very, very, very exciting for the way that I practice and what I want to do. But it's not current that I've seen. There's some people that are like, "Oh, this regrows my," and I'm like, I haven't seen it. Like, send me. I'll try anything. I'm very open-minded. I'll try it, but I haven't seen it happen in the sense because the the tooth has multiple layers. So you have your pulp, and that houses your lymphatic drainage system, the nerves coming to your tooth, and your blood supply. So you need all three to be properly housed, right? Then after that, you have your dentin, and the tubules are much thicker for the dentin. And then you have your enamel. So the tubules are much thinner. That's why people who lose enamel have a lot more sensitivity because the tubules of the dentin are exposed. So the complexity of the tooth structure is that you have multiple sorts of cells. You have lymph, you have nerve, you have blood, you have dentin, and you have enamel. And I know I'm like just dumbing it down just to the basics. So that's the challenge that I think they're going to have to find because all these are very interconnected and merged together,
Mm.
the different types of cells.
And the nerve cells are what gives that sensation of pain for people, right, when they're having
Exactly.
infection.
Yes. Yes. Yeah. Yeah.
Mm.
So nerves are good. We want our nerves to be happy and healthy. And that's why we have to be very vigilant of drilling on our teeth. Like, let's only drill only when we need to. Let's use lasers when we can because it can prevent a lot of nerve damage. And then sometimes these nerves, they kill themselves, like from trauma, and it causes necrosis. And a very common question, I'm sure you got it. If you have a gray or a brown front tooth, a grayed out tooth, that's most likely it's a nerve that's dead. Like your body
Oh,
does its own root canal from
wow.
trauma, yeah, to it. So
Wow.
kids and so the nerves it's a very sensitive area and they need to be supported properly also when you do drill on a tooth. And that's where also the vitamin supplementation also come into play.
Awesome. I heard in a TED talk, I can't remember who it was, but it was like a 10-minute, and the dentist was saying with a dental issue, you don't feel the pain until it's gotten developed to like the end. Is there truth to that?
Total
Uh,
truth. And that's
yeah.
I don't know if you remember at the beginning I said it's like a silent disease. There's a lot of silent illnesses that silent diseases. So when you start feeling pain in a tooth from a cavity, that cavity has gone through the enamel, has gone through the dentin, and it's already at your nerve. Okay. So if you're starting to feel pain from a crack to where you can't like bite on anything, like you're like if you have a real crack down your, and we saw a lot of those in COVID. It's crazy how many people crack their teeth during COVID because just from the stress and the grinding. That's why it's very important. So if you have a smaller crack on your tooth, and especially in the back, you take care of it right away. So, because cracks propagate, and because once you start feeling it and it's gotten to the nerve, not game over, but then you get into it. It's an unideal situation, and then you have to start discussing things like extractions, potential root canals, and both of those are not ideal treatments that I prefer to avoid. But yeah, it's a sign. And then if you start feeling gum pain, that means that localized infection, gingivitis, has traveled to your bone and it's become periodontitis, or you have a severe infection in one area from like a popcorn kernel or something like that, and then you got to get it out. But once you start feeling pain, it's pretty advanced.
Wow. Yeah, it's a little esoteric, but I don't know if you've seen me talk about the infopathy, the little glowing pad. And I interviewed the guy a couple weeks ago, and he said, so basically it's like homeopathic frequencies in water where you can like drink the substance. So they basically download substances digitally, and then you could upload them into the water. And I guess
Is that
someone
like
had
imprinting?
yeah, imprint. Yeah,
Yeah.
imprint. And
Yeah, yeah.
someone had like sensitive teeth, and they did the sensitive teeth program for 2 or 3 months, and they said it went away. But when he told me that testimony, I was like, I wonder what their fat soluble vitamin status is, and I wonder if it did anything to the root or if it was like a just like a band-aid. Like, it's really interesting that took away their sensitivity.
That is really interesting. Or they maybe better hydrated with,
Could be, yeah.
I just took a German homeopathy class not too long ago in Jersey, and we spoke about dowsing and imprinting, and I mean there is beauty to that. Like it's not medicine. It's I get not treatment. What do you call it? Pregnancy brain on crack right here. An offering that I think is beautiful to try. But one of my closest friends right now is studying water and the structure of water and imprinting on water. And the way you talk to yourself, Matt, imprints on your mind and your body. And I talk to my baby a lot more. Like this pregnancy, I'm a lot more conscientious than I was my first couple of pregnancies. And the way we talk to our water, the way we cook our food, the way we eat, the way we need to slow down to really absorb, that all makes a difference. So I believe that can change the level of sensitivity. Yeah, but I'd love to learn more, like about, yeah, vitamin content, if there is any. Also hydration. Hydration plays a huge role in healing and your lymph draining. Your teeth, like your teeth are part of your lymphatic system. If you're not hydrated, if you are dehydrated, just think what happens to your teeth. It's not going to
Yeah.
drain. It's, yeah, but
Yeah.
that's super interesting.
And there's I know back when I was raw vegan, like there was a heavy emphasis on pH balancing, normally in the blood, but then they would move to, different pHs in the different parts of the body, and how we're all overly acidic, which I think is very simplified, explanation.
Yes.
Um, but I mean, I look at my life and I don't do well on wine, so I stopped even the healthiest wines. I stopped those. But coffee, I'm a big cigar fan. People know, um, occasional Mexican Coca-Cola. Things are very
Yeah.
acidic. Phosphoric acid, carbon monoxide, just acids in coffee. Even orange juice, I like, or citrus juices, lemon water. What's your view on, like, after ingesting that? My kind of mentality, what I do is I'll chew like xylitol gum. And I notice if I do go overboard, I get kind of like a upset stomach.
Yeah.
So a lot of time I'll just like chew it, keep it in my mouth, swish it around as like a mouthwash, and then spit out the xylitol mixture on the ground.
My point of view that on that is live, c'est la vie, like live, like enjoy your life. Of course, in moderation. Like if you're drinking like 10 cups of coffee every single day, I'll be talking to you a little differently than if you're enjoying like a cup or two. Okay. Um, I'm pregnant right now, as everyone knows. I drink a cup of mate a few times a week. I really enjoy my mate. It's so healing. It reminds me of my child. I love it. Is it ideal? No, because it has caffeine, but it's ideal for me in the season that I'm in right now. So I wouldn't tell you, oh, stop cigar smoking. If you're a chronic cigar smoker, you are obliterating the blood supply to your mouth. But if you're having an occasional cigar and you're enjoying it, please enjoy it. Like enjoy life, because those beautiful hormones that you're receiving and neurotransmitters actually offset the negativity of the cigar or whatever it may be. But so what we try to do is like mitigate. Like, so for example, if there was this one guy, I didn't see him for a year and a half. Like he disappeared from our office. I'm like, oh, he must have moved or something. He came back with 7 cavities. I'm like, what's going on? Like, what's happening? Like, are you severely stressed? What are you doing? And we couldn't figure it out. And I think after speaking to him for about like 35 minutes, I found out he was drinking chronically Coke Zero and carbonated water. So he was so about 7 a day. That's a lot to have your teeth chronically exposed to that. So am I going to tell him to stop? I never do that. I never do that because people stop and change at the right time. I educated him why that's not ideal. And then I gave him options. For example, the way you chew your xylitol and spit it out, or so I gave him options. So drink normal water after you drink your Coke Zero. Maybe go from 7 to 4 in a day. Get maybe more frequent dental cleanings. Like during my pregnancies, I'm getting cleanings every month. That's just what I need right now. So yeah, that's how I address that. Like for me, fruit juices, I care a little less for adults than kids because kids get addicted to that sugar and they love it. So I always say water it down, and I would just offer regular water for my kids if possible, unless we're out of the house. I'm not a crazy mom. Inside the house, we're pretty healthy. Outside of the house, they can have their cake, their candy. I don't care. Like I'm not going to create any, anorexia and weird associations with food with my girls. But xylitol, I want to say something about xylitol. It's good that you're neutralizing with xylitol. The way you neutralize xylitol, because you get a lot of saliva. So what you're doing is that your saliva is like the most amazing shower for your teeth. We want saliva. If we dry up, that's the problem. So you're getting a lot of saliva in, and xylitol is a sugar alcohol, and it kills bacteria. The bacteria can't break it down to produce acid. So you're decreasing the level of acid production. But xylitol in excess can offset the microbiome in your mouth. So I'm not a huge fan of chronic xylitol use. But yeah, that's how I deal with life. Like it's life. So, wine doesn't work for you, but cigars do. Enjoy your cigar. Don't overdo it. And if you do, we're here to help.
Yeah. Well, I like that you validated my because I sell a water filter and it injects magnesium bicarbonate and various forms of magnesium just by the nature of the Corsex media at the end, remineralizing the water. But I'll swish with this the whole time and then after.
Perfect. Yeah. And when you're getting proper hydration and you're eating very well, your nutrition's very well. So a cigar here and there, and I have Mexican Cokes or the Middle Eastern Coke, like maybe 2 times a year. It's good. With my burger, I really enjoy it.
It's a good combo. Yeah.
It's a great combo. Like it's fantastic. But yeah, even me, like I enjoy it, but I know to swish very well with water after, drink a lot of water, and make sure my next meal is super healthy. It'll just make me feel better.
I read a study because I sell MK4, MK7, K1
Yes.
supplement together, and I read a study where K2 regulates the pH of saliva. And looking back at my story with chipping my tooth and veganism, it just all the dots connected. I'm like,
Right?
oh, the pH of my saliva was probably not
Yes.
ideal back then.
Yes. We test everybody's pH, like we do these strips, and it just gives us an idea of where you are, like if you're super acidic or you're in a good. And then from that, I can ask even like deeper questions to my patients, and then I can further guide. But yeah, K2 is very, very, very important. So if you're eating liver and organ meats, you don't really need to supplement. So me growing up on that, I feel it gave me a really nice storage for what I went for through in life. And I want to say something like when you're younger, it doesn't impact you as much. It's like it's when you get not just older. I don't want to use the word older, but like here I am, I'm almost 40. I'm at my third pregnancy. If I didn't have those healthy habits when I was younger, my teeth would be in a much, much worse shape than I am right now. So
Mhm.
it's all about the consistency and not just what you do in like one thing in one day. Okay.
Mhm.
So enjoy your cigar and
I
your
love it.
orange juice.
I love it. What pH do you look for? Is it like around 8 in patients or
It's a 7.
7? Okay.
Neutral pH. 8 is a little more on the alkaline side. But 7, yeah, 7 to 7.4.
Okay.
I've read multiple studies like 6.8 to 7.4. I don't like going below 7, but I mean, there isn't exact numbers. People aren't spitting out that much saliva for us to get their exact pH. It's very, we check for nitric oxide and pH, so that gives us an idea. And then after going through their nutritional habits, their snacks, how often they snack, when they're snacking, what kind of water they're drinking. So I didn't know you sold that bottle. That's
Oh.
great. Have like a bottle that infuses. I want to get one. That just magnesium. That's
Yeah.
amazing. That's really, really good. Um, and then what they're eating, like for their primary meals, and that's very important. Like what kind of supplements are they taking? On what basis? Are they low on vitamin D? So there's just so much more to it than
Mm. Yeah, I'm
like
sure you have to educate quite a bit when someone comes in because there's all these thousands of micro decisions that they made that play into their issue, right? When they come
exactly,
into you eventually.
exactly.
Why do you check for nitric oxide? I'm curious because I know those supplements were starting to trend in the biohacking world, like the NO
Yeah, yeah,
tablets and stuff.
yeah. I check for nitric oxide to see if someone is a mouth breather or not, like
Mm,
how much, because if you're a mouth breathing, say you do everything right, Matt, everything right and perfect, but you're breathing through your mouth chronically at night and like you have sleep apnea, nothing like really matters. Like it's why? When we're sleeping, we don't create new saliva. So we're depending on the saliva that we go to sleep with. And if we're sleeping with our mouth open, it dries out our saliva. Our saliva is like our immune system. It dries out our tongue. It dries out all our oral structures. Your body can't detox properly. Your tongue can't detox properly. And the bad bacteria, the decay-causing bacteria, have a rave in your mouth. The propensity of your gum disease, because of the chronic dryness in your mouth from breathing through your mouth, it's a lot worse. So if you see, there's some people, I don't know if you notice, I notice because I'm like sick like that. I'm always looking at people's mouths. But if you see a lot of redness in somebody's gums, it's either poor dental work that's impinging or chronic mouth breathing. And it really, really impacts the overall well-being of that person. So ADHD medications, for example, I just want to say something about that. Um, a lot of our kids are starting to mouth breathe because they're not developing properly. And when they are mouth breathing, they're not creating enough nitric oxide. Nitric oxide is very important for vasodilation and oxygenation of your body, including your brain. So they're putting all these kids on anti-anxiety and ADHD medication, which further dries out their mouth. And then they come to me, they're sick in the head, that like poor, I feel for them. they have cavities, they have gum disease, they're traumatized from the dentist. And do you see how that becomes a perfect storm? And a lot of times, if they get expansion, get to the root cause of the problem, why they're mouth breathing, why are their adenoids big? Do they have an allergy to a food they're eating? What kind, like each one of my kids, we have air filters in every single room. I live in LA. I don't live in the cleanest environment. Like I do live in the mountains in the cleaner side of LA, but it's still LA. So I got to do what I need to do to cleanse the air that we're breathing while we're inside our homes, because air inside our home sometimes is worse in quality than it is outside of our home. So
Yep.
it's so multifactorial, but the mouth breathing is a very, very, very important thing. Men, it's very highly linked to erectile dysfunction. Then they put them on Cialis and Viagra, and then it's just another perfect storm, right? For heart issues. So it's very important to find out somebody is low on nitric oxide or not from an oral perspective, because it tells us a lot about their breathing habits.
Those were awesome points. Yeah, I interviewed the guy, Somnifix founder, on
Yes.
the mouth tape, and I think I
Yeah.
started with like the 3M tape, and a lot of people
Yeah.
prefer that, and you have to experiment with what feels right for you. But I know a lot of people combine like the nasal, the strips that open your passages with the mouth
I have
tape.
some right here from Hostage. So there's Somnifix. I really like the Somnifix one. There's Hostage, or just do whatever works for you. There's the VO1 tape. There's the Myo tape that goes around your mouth. But very important, before you mouth tape, you need to make sure that your nose is patent, like you are able to breathe through your nose, especially for kids. I got so much hate on this one Instagram post that it's so funny. It's not funny. Like people are just so angry right now in the world,
They
but
are.
because I mouth tape my kids, and I'm like, I'm not like, you're abusing your kids, you're abusing your child. It's but make sure your kids can breathe through their nose. Obviously, don't be an idiot and like shut their mouth and they're congested while being sick. Like, let's use our freaking common sense here. Just like another pet peeve of mine. Control your thumbs, people. We're here to help.
I think
But
it's only going to get worse. Yeah, it's COVID just, yeah, it intensified the tension and all the angst.
COVID brought out the truth of a lot of things. Just a mask remover. Um, but we won't go there, Matt, today. But so I always say that nasal hygiene is more important than oral hygiene, if not as important, more important than. So obviously, don't mouth tape if you're congested. Obviously, don't mouth tape if your adenoids or your tonsils are like kissing each other and you have like anatomical obstructions to your breathing. Please don't mouth tape. So please use your common sense. But mouth tape is incredible when used appropriately for children and for adults. And if anything, you just wake up with a clearer head and you feel better. Like, let's not even get into the biology of it. You wake up feeling better. And that to me is everything.
Yeah, I'm inspired to get back into it because I have both the nasal openers and the mouth tape, and I just took a break. I
Yeah.
and took a break from the Aura Ring, so I don't know. I have to go by how I feel, which some people is better, but yeah, I'm gonna get back to that tonight. I'm inspired.
Yeah, and for me, I don't mouth tape. I mean, when you're pregnant, I wouldn't mouth tape, and the reason is because the increase in progesterone, you're creating more blood, right? When you're pregnant, to create a placenta to support your fetus. And all the blood vessels, including in your nose, are bigger, more flow. So you get congested a lot more easily. Like I need to sleep propped up because I'm having a really hard time breathing through my nose right now. Like I'm so big and I'm uncomfortable. So I make sure I do clear my nose out, but I wouldn't mouth tape just because of that chronic congestion. That's just partially hormonal, and I did get sick once, etc. But what I do is after sickness, not that I get sick very often anymore, thank God, I do reset with mouth tape. So if you're waking up feeling great, amazing. I would like maybe mouth tape like once a week just to make sure you are breathing through your nose and not your mouth. But yeah, like you don't have to be on mouth tape forever. That's what I'm trying to say.
Mm-hmm.
It's a
Right.
habit.
Do you like humidifiers? Because you were talking about like the dryness, and I I feel a massive difference, maybe because I'm intermittently mouth breathing at night. I don't know. But if I don't run a humidifier, I don't feel as like rested. And I know, I mean, we're breathing in the moisture too through our nose, right? But
Yeah, 100%. I just got new humidifiers as well, the CarePod ones, that ones that are stainless steel.
Mhm.
So that's part of our nasal hygiene protocol in our office for people. Some people need dehumidifiers if you're living in a very wet, higher levels of humidity. In our home, we need humidifiers. And what I get, especially for our children's rooms, as a mom, you just think about your kids, but when you're making things different for your kids, you're also making it for your home. Like you're changing things up for your home. I see the humidity levels, and when it's dry, we get nosebleeds. And when it's dry, what happens? Our body starts creating more mucus because it doesn't have enough humidity inside your nose. I dumb everything down because that's how I think about it. So I don't
It's
use
great.
technical terms. Um, and then you wake up with chronic congestion. That's what happens to
Mhm.
my kids. So when I'm using a humidifier, so what I do, let's give like our listeners like something that's something tangible that they can do. My kid's bed is right here, right behind them. There's a humidifier and then an air purifier. So not only are they getting good quality air, but also hydrated air. And that's very important. And they wake up feeling different. They wake up feeling more rested. And times where, like, if they're sick, I nasal rinse or I Neomed like the neti pot to make sure the congestion's out. And I mouth tape from time to time. Now they're consistently breathing through their mouth, through their nose because I did do expansion on them. Like I made more room for their tongue and we're doing myofunctional therapy. So it's a whole can of worms, it's like a loaded question, but there's a lot that goes into it. But once you figure it out, it's so worth it because you get rested humans in your home and it's nice to be
Yeah.
rested.
Yeah. Good sleep's definitely the foundation of health.
Yes.
Had periods of my life of sleep deprivation, even without having children, which I think is a whole nother level that if you don't have children, you don't get it. I have parent friends and it's, yeah,
Yeah.
I can see the, the mental tax. So time's flying and we're definitely going to have to do a part two, but I do have some like burning questions I want to run through on my end, still.
Let's do
Uh,
it. Yeah. Happy to do part two too. Yeah.
yeah, there's so much here. So you were saying you're going in once a month during your pregnancy, for checkups and or cleanings, and I wanted to touch on because that's it's the common meme. People, and I did it for years. I didn't go to the dentist for like 4 or 5 years, and that's when I went in. I don't know, about a year and a half ago, and I got um some ceramic fillings. Fortunately, I didn't have to get any root canals, which was great. And I
Good.
credit that to like supplementation and stuff. But I think the reason why people dread going into the dentist is because the cleanings are often uncomfortable,
Oh,
painful. When I had my thing, I kind of bundled it together. So they did the fillings and the cleanings, and I was bleeding like crazy. So they just put me under with the gas, which is a whole ordeal because you need to have someone drive you there and pick you. And that's a whole um, but I know you can use like topical anesthetics. So what have you found in your patients, and what's kind of your view on all of that? That just the
I love this
uncomfortableness of it.
question.
Yeah.
It's such a great question. Here's my thing. If you're experiencing a lot of pain during your dental cleanings, it's one of two things. You're getting a simple cleaning where you actually need a deep cleaning, where you actually need to be properly numbed so that you can get properly cleaned out, or your hygienist or dentist don't know how to use the instruments. Okay. And they're very rough. Of course, every once in a while, there may be a tinge. Like I have two areas that I have a little bit of recession in. I don't care how gentle you are, it's going to hurt. That's just how it is. But we actually had a hygienist. Obviously, I'm not going to say her name, but I didn't know she was hurting our patients until later. And I was like, holy shiznit. And I hadn't tried her on my teeth, which is I never do anything I do on anybody on my patients. Like any employee that does anything, any impression, any scan, whatever, any material I try myself so I can guide better. Anyways, she was hurting them, and then we finally she doesn't work for us anymore. She's just like very rough. Like in hygiene school, they like teach them to like they're scraping the bathroom floor of a bathroom that hasn't been cleaned in 20 years. Like it's insane seeing the hygiene students in school. It really bothers me. So now our hygienists, we have different tools. It's a little more expensive to buy new tools and the whole set of tools. So a lot of practices don't invest in the right equipment sometimes. But if the hygienist knows how to utilize the tools and there isn't severe recession, severe calculus buildup, plaque buildup, then it shouldn't be a gnarly experience. If it is, please ask your dentist, why is it hurting so much? Like, do I need a deep cleaning? Because sometimes if you have like an area of your face that is inflamed and I'm trying to clean it out and I keep touching it, it's going to hurt you. Like if your face is blood and I'm trying to clean your face, I'm going to need to numb you to be able to like clean it properly so that we can do some wound healing. Same thing with our gums, but people obviously don't see that because it's a hidden area. So whenever patients call us, they're like, can we get a cleaning at the time of the appointment? Because we have a lot of patients traveling from out of town and driving like 6-7 hours away from us, which is such an honor, but we can never promise yes. It's like, it depends. If you need a simple cleaning, it's a simple ozone cleaning that takes about 45 minutes to 55 minutes, and we're happy to do that at your appointment. You may need a deep cleaning where we actually need to numb you and need to go underneath your gums to properly remove what I call rose thorns. If you have a rose thorn chronically, just think about a rose thorn underneath your gums, and I'm trying to get rid of that, but you're inflamed, you're going to be in a lot of pain and you're not going to like me as your practitioner. So those are the two main reasons that it's painful. Ironically, the more you go to the right dentist, the less work you're going to need and the more prevention that they can do, and it's just a happier experience. So avoidance is really neglect.
That's interesting about the tools. Are they still metal based? Because it'd be nice if they were like a soft rubber or something. That's, I don't
So
know.
so there's some people so there's the vibrational tools, right? The ultrasonics. Then there is the metal tools. And then we have like more of a few of ones with tips with plastic that is for implants. I know they're gnarly looking and they're so like, they can be very scary, but when used properly, you shouldn't feel the pain. Like it's because each tool has a different curvature and it needs to be properly, like, when you want to cut your meat with a knife, it needs to be a good knife. You can't have a crappy knife to cut a good piece of steak. You need a steak knife. Like you need something strong. When you use it properly in the mouth, it shouldn't hurt. It really, really shouldn't. And then if it does, then you may need a deep cleaning. And then afterwards, so a lot of our patients that need deep cleanings, they follow up with simple cleanings every 2 months for 6 months, and then we graduate them to every 3 months. Like core gum health is so important to be done appropriately.
I've heard, I don't know if this is a myth. Like I think my dad was saying he's upped his strength of the waterpik, and over time, because there's this like weak gum idea, and if you blast it with a waterpik, you can strengthen your gums. Is there any truth to that? Or
False.
okay.
Oh, that Matt's dad, this message is for you. What's his name?
Jim. Yeah.
Jim, stop. I have like a love-hate relationship with water picks. Like I love water picks. They're great, but when they're used inappropriately, it can cause more recession and it can cause more harm to your gums. So I do like it on the lower setting, and I do like to say that it doesn't replace flossing. The water pick is an adjunct. And there's 3 main types of people that I like using the water pick for. Like you're young and healthy, you can floss, you're fine. Your hands work very well. You're not a teenager with braces. So teenagers with braces, I always recommend their parents get them water picks because it's easier to get crap out. It's harder to floss, and they're teenagers. I don't know if they'll ever floss. Okay. The last thing you need is a teenager with a ton of cavities once you get their teeth straightened. Okay. That's a really hard day for parents and the teenagers. So we try to avoid that. Second, if you're in hospice and you need something to clean out your mouth and you're unable to take care of yourself, so that's something easy that the nurses can do. And elderly with poor muscle control, or like Parkinson's elderly that don't have a grip, or someone who has a very busy lifestyle, you're a businessman, whatever it is, you have a very busy lifestyle, you want something to help you control your plaque levels. But I always tell them that it doesn't replace flossing. So it's
Mm.
in conjunction to flossing.
Is there a brand of like water flossing picks that you like? Because I know some have the kind of cheap, I don't know what
Yeah,
it's plastic, and then some
yeah,
are like really gentle and
yeah. Someone just told me about the vibrational water floss, the Slater, the Slate. I'm not sure what it's called.
huh.
Please don't quote me on that. I haven't tried it. I will try it, but some people are loving it. I like the Humblebee, I believe. The Humblebee, it's a Swedish brand. It's more sustainable. It's good quality floss. It doesn't slide through like Glide and all those, but those are all have PFAS and forever chemicals on them. I don't want to be using that every single day. And I want to say something, flossing shouldn't hurt. Like you shouldn't be in pain when you floss. If you're in pain when you floss, please go visit your dentist. And please find a dentist you trust
Yeah.
because it's a very intimate area. And when you're in pain, sometimes you need to do things that you don't want to do, like numb and do a deep cleaning and under nitrous like you did.
Mhm.
And you need to be in a safe place. I think I want to touch on safe, like you need to feel safe because you don't know, it's like a mechanic. You don't know what they're doing or a plumber. You just got to feel safe with your dentist.
That's
But
pretty crazy. The electric flosser, I didn't even know that existed. That's fascinating.
yeah,
That's
it
pretty
came
cool.
out recently. I mean, I think in the past
Cool.
like year or year and a
Okay.
half, but
Wow.
haven't had a chance to try it because of my pregnancy.
Hmm. And you brought up ozone too, because I've been into ozonating water for years. Do you think that's a good mouthwash to do, like just
It's
swishing with ozonated water?
wonderful. It's
Mm.
wonderful. I love ozone. We use ozone after our cleanings. So after simple and deep cleanings, we inject ozone gas. We infuse ozone gas around each tooth. Each tooth gets ozone love. And ozone is a gas. So gas, it goes to places where us humans don't go. And we don't, I mean, a lot fewer antibiotics are way overprescribed. And they used to teach us in dental school to put antibiotics in deeper pockets in your gums. Now we just infuse with ozone and it works so beautifully. And then to
Awesome.
prevent like cavitations, to promote healing, we use ozone injections, and also to reverse and remineralize the dentin cavities. I use it in my root canal prevention procedure in the office. Ozone and the laser has helped us prevent maybe 70% of root canals that would have been done.
Wow. That's really cool.
You see the tooth structure getting stronger. Of course, unless it's like a rampant cavity, I can't help you. We have other problems to deal with. But if you have a cavity that's close to the nerve, I'd say 65 to 70% of the time we can prevent that from turning into a root canal.
Wow. That's
Ozone
awesome.
is the key.
That's exciting. Uh, so this is a super controversial one and one that I have a different opinion on. Fluoride, and there's Stannis, there's sodium fluoride, obviously, is the most well known. I think there's
Yeah.
a third or a fourth type as well. It's like three or four different kinds. And like with toothpaste, when I got into health in 2010, it was like, the fluoride stare, and it dumbs you down. And I started to like differentiate between drinking it and then like topical use, which is like never distinguished. It's like always, I guess apparently you're eating a whole tube of toothpaste. I do way better with it than hydroxyapatite toothpaste. And I tried that for a while, and my mouth feels cleaner and stronger with a, not Crest, but a clean, like I use Saint, or there's different brands with cleaner ingredients.
Mhm.
But I'm wondering with your patients, have you seen some people do better with either or? Like it's not across the board, it's one or the other?
Totally. This is such a great question because everyone's so, I mean, I am anti-fluoride. I don't think we should be ingesting it. I don't think we should be putting it in baby bottles for babies or creating formula fed babies. I don't think it should be in our water, period. Like it is all that and more. So that's my base. But it's so interesting that you asked this question and I get that asked in my office by like maybe 20% of my patients. Toothpaste is very personal. Okay. Toothpaste is also topical. You do get some absorption through your mucosa, but you're an adult and you probably are spitting most of that out. And you're detoxing with other things in your life. I know you take your vitamin E and your vitamin C. If you feel that fluoridated toothpaste is making your teeth feel better, I say, who am I to tell you to stop? Okay. I have some patients that are like, I give them prescription and it's not very high in my office. I personally do very well with hydroxyapatite, but higher doses of hydroxyapatite. Like most of the toothpaste out there have very, very low levels of hydroxyapatite. And that's helped me. My kids don't have any cavities. I only use hydroxyapatite on them. I'd say fluoridated toothpaste, if you're an adult and you feel that it makes you feel better, I fully support you in it. Just please don't drink fluoridated water. That's where it harms you. With kids, I'm a little more, let's do the hydroxyapatite because they don't have control of swallowing, especially as you're transitioning from toddlerhood to, you know, are they able to spit properly? How's their, with kids, I get a little nervous, but with adults, I say, whatever floats your boat, just please don't drink it and don't eat the whole tube of toothpaste. That's my stance there.
That's great.
Yeah.
Um, this might be the last question for me, and maybe we can get through a couple Q&A questions. So the type of toothbrush, uh, like the floss, there's probably different grades. Because I know a lot of the bristles and people freak out about it. I don't know if it's a real issue. I guess it's like plastic based or something. I currently am just using your basic Costco electric toothbrush. Is there an upgrade to that in your opinion, or?
Yeah, I like to live my life with the 80-20 rule. Like there's certain things that I'm going to invest in. For me, the most important is the quality of air that I'm breathing and the water that I'm drinking. All right. There's some people that are like, oh, the Oral-B Sonicares are horrible because they are plastic and then they prefer the bamboo toothbrushes, or there's a great brand called Living Libations. I actually like their
Mm-hmm.
toothbrush. Someone gifted it to me and I'm like, oh, it's a weird head. And I'm trying it and I like it. But here's what I say, whatever gets you to brush your teeth. So if you only have access to Costco toothbrushes and you like them, the Oral-B ones or the Sonicares, great. Please brush your teeth. The only thing I'll say to that, please change your toothbrush heads every 2 months. Okay? Don't wait to every 6 months. That's BS. Okay? Especially if you're prone to recession and sensitivity, because especially with the plastic heads, like I personally don't use plastic heads at home because it's just, it's a process. I did most of my life until, as you know more, you change more. But it's not going to harm you. It's not going to kill you. It's fine. But the plastic, when it gets old, that can cause recession and sensitivity. So that's number one. And so change your heads often and make sure it's a soft head. I don't like medium and strong, harsh, or hard. So it's soft, medium, hard. Whoa, like total pregnancy brain. I don't like medium or hard. Please, if you're using a hard toothbrush, you save that for the bathroom floors or your night guard that you're scrubbing. But don't scrub your teeth and your gums with that. You need soft. You need to brush for 2 minutes. If you do that with a toothpaste that you love, you're going to be just fine. Yeah.
It's great.
Yeah.
That's awesome. Well, let's jump into a few questions here, stuff we didn't cover. Best tips for receding gums or gum health overall, specifically for women, is that our mouth pH is different than men's.
Yes. I love this question. This is why I do what I do. Gum health for women. that we can do a whole podcast just on that. So that's a very loaded questions, but men and women are not the same. I'm gonna say it. I get some hate for that every once in a while. We're not the same. We're never gonna be the same. Hormonally, we're different. And it starts from puberty. So we go through multiple transitions. I'm going through a transition right now. You're never gonna feel, Matt. And my husband is never gonna feel. So it's very important to really honor that for the sake of our women, which makes the world a better place when they're honored. So first, puberty, that estrogen, progesterone rise, like when a woman starts menstruating, her gums start getting a lot more sensitive to plaque, and you have local inflammation during her menstrual cycle. So girls need a little more support, especially during that time. That you're in reversible phase. Okay, you're young, you have great collagen levels, your vitamin C levels aren't as, or the dosages, you don't need them to be as high, etc. Then, so you're menstruating every month, you go a few years, and then say you have a pregnancy or you have IVF, you're having difficulty having babies. And a lot of people right now are going through IVF and egg freezing. Women are having babies much later in life as well. I'm going to be 40 having my third child. I mean, I'm proud of my life and what I've done, but it's a little later and it's great, but I need a little more support. And then move forward a few years, perimenopause and menopause. That's when the estrogen and progesterone drop. And estrogen is needed to uphold collagen in our mucosa. Okay. So if the collagen support isn't there, you're going to get recession, and you're going to combine that with mouth breathing, me with the increased progesterone during my pregnancy, combine that with a few miscarriages. Do you see how like all these different changes in a woman's life can impact her oral cavity? So when it comes to gum health, I say less is more, but more is less in the sense of prevention with your dentist. I feel for women, I think it's so important to find a safe place, because your dentist is in a very intimate area of your and when you're under nitrous like you were, or sedation, or they're doing the routine cleanings or whatever, this is going to take it a level, may get a little nutty, but your mouth is your part of your throat chakra, and it brings out a lot of emotions when you're unable to properly communicate with your practitioner, and it will make you less likely to go visit them again and again and again. So I hope I've made my point. I don't know if I'm rambling here, but for gum health, it's really important for women to take a very proactive approach. Change your toothbrush frequently. Eat a very nutritious diet. Make sure you're getting enough vitamin C, collagen. Take care of yourself. If you're grinding, find out why. If you're having back-to-back miscarriages, or you're doing a lot of IVF rounds, make sure dental care is part of that. Like me, I'm seeing my hygienist literally every month to month and a half, and that's how I'm still okay. And I still have localized inflammation. So, but
And
yeah,
mouth breathing too, right? Taking care of that at night.
100%. Take care of your mouth breathing, prop up. If you're not pregnant, figure out why you're mouth breathing. It's so important, because if you have the hormonal changes and the dry mouth, it's a perfect storm. I've had menopausal women that have transitioned from perimenopause to menopause develop like 9 cavities within a matter of like 3 months because of all these changes. It's no joke. And then it gets really hard on her, because it's like you're sitting in the dental chair for hours, you're paying a lot of money. Good dental care costs a lot, because the tools that we have, and the electric hand pieces and the lasers and it's a lot, so prevention is worth an ounce of care.
Yeah, it sounds like a whole podcast.
Yes. Yeah. I'm like trying to like simplify it. It's very hard for me to simplify that
That
question.
was great. Yeah.
But I love that people are asking that, because if someone's asking that, that means they're waking up to that. And I just want to say something really quickly. My story at the very beginning, when I'm like, I had a really hard time. I lost a front tooth. So I was like, am I the only one dealing with this? Like, I felt extremely alone. And here I am. I'm normally super confident and happy-go-lucky in this. And I feel like I lost a lot of myself postpartum. I went on Facebook, this LA mommies group. It's like one of the craziest group I've ever seen. Like moms can be the most helpful people and the meanest people to each other. It's insane. Anyways, I posted like at midnight, and within like 3 hours, I got like 300 responses of women saying of all these oral changes that happened during their pregnancies. So this has been going on for years, and it's they used to say you should never visit your dentist while you're pregnant. False. You'll lose a tooth per pregnancy. That's what's happened historically. Maybe it's true in the past, but it shouldn't be. It doesn't need to be. It's preventable.
That's great. Well, at the buzzer here, we'll ask another loaded question, maybe this last one. Are root canals really as bad as some say? And then kind of piggybacking on that, my friend Bob said, I got a root canal. What needs to be done now that I had it done?
Wow, you gave me a very loaded question. You want to end with a bang. Well, so yes, root canals, most of them are on their way to infection, even if an endodontist has done them. So that's why I'm so passionate and adamant about preventing them in the first place. And that's why we got to look at everything and here, like beyond our oral cavity and our gut to prevent them. So say you've already, Bob, you have your root canal. I also don't want people to like start stressing if they have a root canal, because that stress is like as bad for you as anything as well. If I learned anything during this pregnancy is how bad stress is for you. It's like, God, this was like, I need to surrender. And I've been taught a massive lesson. Another podcast, but, if you have a root canal, you get a scan. It's a CT scan. It's a three-dimensional scan. You don't see if you have an infection on a two-dimensional scan. And you evaluate. Say Bob is extremely healthy and Bob is living a beautiful life. He's not chronically stressed. He eats very well. He doesn't mouth breathe. And he feels like physically he's feeling good. Am I going to tell him to extract that root canal? Probably not. I wouldn't advise that to myself, so I wouldn't advise that to Bob. There are some holistic biological dentists that are like, root canal, you must extract every single root canal because it's a dead thing in your body. And ideally, I would not want a root canal. I probably would opt for an extraction. Now, knowing what I know, and I just don't want any sources of inflammation in my body. There is a person here in LA. She does more of a holistic root canal, if that holistic.
Yeah, I was going to ask if there's an alternative to it. Yeah.
There is. And I always love to give people alternatives. Again, it's not ideal, but we don't live in an ideal world. And the fact that you even need a root canal in the first place means you've gone through an unideal situation. So I'm trying to give you my best with the unideal situation you're giving me. Okay. But, so there's a doctor, her name is Valerie Cantor. There's other doctors here in the LA area, one in Manhattan Beach, and they use ozone and lasers for root canals. So the beautiful things about this laser that we have, it's a Photona laser. I hate their service department. It drives me crazy, but it's such a great machine. Lasers go to places that us humans can't go. Ozone is a gas. It travels to clean areas that us humans cannot clean. And don't let anybody touch your tooth, like root canal wise, without a microscope. They need to see it's a very, very small space. So you need to make sure that you find every single canal. There's some teeth in our bodies that have 4 canals instead of 3 canals. So I'm giving a little excess information because I want your audience to be a little more knowledgeable and just know it's not like straightforward, oh, okay, infection, root canal right away. There is alternatives. And we got a lot of patients from out of town that, for example, see this endodontist. She retreats all their root canals and gets rid of infection. And she fills it also with a bioceramic material that is a little more much more biocompatible with our body. And then we restore them, whether it needs a crown, whether it needs a onlay, inlay, never a filling on a root canal. It needs to be, it's either an onlay or a crown. It needs to be properly, because root canals do make your teeth more brittle because you don't have a blood supply, lymph, and nerve. And then you monitor. And every couple of years, you take a scan and you see that's why you got to have a very good relationship with your dentist to monitor these situations. But it's not black and white to me. It really depends on the patient and their status in life with regards to their health.
I think you packed a whole lot of like
Yes.
3 podcasts into one, so I
Yes.
appreciate it.
No, that's
Uh,
a great
that's
question, but it's the loaded. Yeah.
yeah. Well, this was awesome. Yeah, we definitely have to get another one because I'll save them like 80 questions or something from listeners on everything from oil pulling and underbite and all sorts of stuff. So,
Yeah.
um, so your website, is it drleedia.com? Is that?
Doctor, we're revamping our website. I'm not very proud of the website that we have right now. It's like just a landing page. Our dental group, that's the name of our office, but people can find me on Instagram at Dr. Leedia, at Dr. Leedia, DrLeedia. But yeah, we're in the process of revamping our site. So don't judge me based on my site. People don't. It's the website is like the last thing to develop. Like I feel like just Instagram is really nice where you just go on and
Oh,
you talk really authentically, and so that's where I'm most active. But we actually are in the process of revamping the site. Hopefully,
awesome.
I send my website girl all the information she needs before I give birth. So it's in the works.
Well, it's impressive, yeah, that you did this show while you're growing a human inside of
Thank
you.
you.
So,
No, I'm feeling good today. So not I told Matt, I'm like, listen, let's play it by ear. And if I'm in labor, I'll text you and be like, I'm unavailable. But no, it worked out great. And I didn't get a contraction. I got maybe one small contraction, nothing crazy.
Cool.
So we're good. We're good.
Awesome.
Yeah,
Well, yeah, let's definitely plan another one once you're
for
up for it.
sure.
And
Yeah.
yeah, thanks so much. This was awesome. I'll put all the links below where you guys could check out her stuff. And yeah, thanks,
Thank you for
Leedia. This was
having me.
fun. Yeah,
Thank you.
stick around as we close out the show. Immediately after that show, I went and ordered the electric flosser that she mentioned, the slate flosser. I've been using that for the past week or two now and really enjoy it. And I also got the flossing picks that she recommended from the Humble company. I've been observing the natural health community for 14 years now. And even in the last few years, I've seen really horrendous health advice, particularly when it comes to oral health. Some people with really big followings saying that you don't need to brush or floss. I really like Leedia's basic 3-step advice: brush, floss, and get dental checkups regularly. For the last 2 years at least, I've done an experiment using a waterpik instead of flossing. And I was really shocked to hear from Dr. Leedia that a waterpik is not a replacement. I had a dental checkup about a year and a half ago, and it was not what I was looking forward to. No root canals, but I required a few fillings. And checking out your teeth and gum health can be a very humbling experience, especially when you take care of your overall health to the best of your ability. So my latest routine has been using that slate flosser. I have no financial affiliation, but it's an electric flossing unit that's really quick and easy. It kind of took me a few nights to get used to flossing again, and I still bleed occasionally, but I find that it's a lot easier to use, especially versus the standard floss, just the string that you use. I used to use the picks, but who knows what those were coated with. And so I'm glad that I now have a couple alternatives. I have the slate flosser and then the Humble flossing picks to use. I can say that my mouth definitely feels cleaner, especially when I wake up in the morning. I just stopped the waterpik altogether after hearing from her that you can actually accelerate gum recession. That's the last thing I want to do. So I'm just going to stop the waterpik altogether and just switch to flossing. So I brush twice a day, once when I wake up and once before bed. And at night, I will floss with that electric flosser before I brush. And I'd imagine that that's helping to reduce inflammation throughout my body, because I've said previously and on social media, and I think in this podcast, that I had elevated inflammatory marker, highly sensitive CRP, and that went down after getting dental work done. So it really does affect everything if you don't keep your mouth in top shape. If you're in Southern California or you want to travel there to work with Dr. Leedia, her website is Dr. Leedia with two E's. So Dr. Leedia. And I think she mentioned that her website's a little weird right now. So that might pull it up. If it doesn't, just add at the end of that dot mykajabi, KAJABI.com. And that should pull up her website. And I'll put the link below. I thought it was really fascinating when she said that a lot of dentists just don't use the right tools or they aren't trained properly. And that's a lot of the time why cleanings hurt. And that's been bouncing around in my mind ever since she said that, because I'm probably in the majority when I say I've never had a pleasant cleaning experience at the dentist's office. So I am inspired to look around and find a dentist that works for me. If you want to check out my website, it's matt-blackburn.com. You could read about my CLF protocol, stands for calcification, lipofuscin, and fibrosis. I actually just posted a snippet from a study on social media with regards to melatonin supplementation protecting against fibrosis in various organs. Melatonin has so many benefits, and the fact that it protects from fibrosis, which is scar tissue induced by inflammation, that's pretty incredible. Here's the exact quote. Melatonin ameliorates the necrotic and apoptotic changes that lead to fibrosis in various organs, including the heart, liver, lung, and kidney. Moreover, melatonin reduces the infiltration of inflammatory cells during fibrosis development. It's a 2023 study. I can't pronounce the last name, so I'll just post the study below if you want to check that out. And if you want to follow along, I do a daily coffee story on the Instagram platform where I post little snippets from interesting articles that I've found. So on my Matt-Blackburn website, you can also find all of my recommended products, most of which have discount codes. Shout out to Masa Chips. That's my friend that makes these really traditional nixtamalized corn tortilla chips. And I just eat them straight. I keep forgetting to get salsa and guacamole from the store. I don't have time to make that stuff myself. And so I just eat them right out of the bag. And when I combine that with, say, a Maui Nui venison stick, that's a really easy, quick meal for me when I don't have time to make food during the day. So if you think you've had good tortilla chips, you have not until you've tried Masa Chips. My brand is Mitolife. You can find that at mitolife.co. Our water filters are just about to sell out. We only have a few of those left. And frequently asked question, yes, it is not a whole house system. It is called an under counter system, like you would put under your kitchen sink. And then usually there's a little spot, hopefully cut out in your sink for a spigot. And that's where the spigot from our premium install kit would go so that you could access water from the storage tank. We just received the water test results for the filter. Really exciting. This is a filter that I make with my friend Austin Sneller of Flow Motion Water Systems. So it's a Mitolife Flow Motion collaboration. Couldn't have done this without him. Been friends with him for many years now. And we tested it for all the metals, hardness, alkalinity, pH, TDS, the halogens, the trihalomethanes, the volatiles, the organics, all sorts of stuff, and all came back non-detectable. I know a lot of people need to see those test results, even though it's well known that certain filtration media will reduce contaminants expectedly with their specifications, but still people like to see on paper that our filter reduced everything. So that will be published shortly. Check out the Mitolife Academy on YouTube. It's $15 a month, and you gain access to 2 private videos every month, my latest research, experiments, and then a live Q&A the last day of every month where you could ask me anything. So that is all for today. I will see you guys next Friday. Stay supercharged.